on the show Adeel. Adeel, Assalamu alaikum, good evening, and thank you for joining us. This, of course, is the show where we talk health, educational and social matters. Today is no exception, and we're very blessed to have you as Chief Pharmacist from a local pharmacy, Roundhay Pharmacy. So welcome.
Walaikum assalam. Thank you very much for your introduction. I'm here today to talk about vaccines and pharmacy and general health matters.
So welcome. The role of the pharmacy and pharmacists has changed a lot, and we're going to touch on that. Let's start off with what you wanted to talk about, which was the COVID vaccine. So as we know, COVID vaccination is an important part of protecting yourself if you're at increased risk of severe COVID-19 infection. There is a number of people who continue to be eligible for what they're calling the seasonal COVID-19 vaccine. So that's people aged 65 or older, aged 6 months to 64 years and at increased risk, living in a care home, frontline health and social care workers, if you're a carer, and also if you're somebody with a weakened immune system. That's just a quick summary of who might be eligible. But Adeel, tell us why you're here.
So we know that in our communities, very few people are coming forward for the vaccination, even though they're eligible for it, even though data has shown it will protect them from serious infections, from serious effects of the COVID virus and the flu virus whilst we're at it, because the flu vaccine is also effective at keeping you safe from the worst parts of the effects of getting flu or COVID. So I'm here to encourage people in our community to come forward to my pharmacy, to another pharmacy, just to help protect them, those who are at risk, those who are over 65, those who are asthmatic, those who are diabetic, those who have heart conditions, and the other groups that you mentioned, because we want to keep them safe. You know, we, as healthcare professionals, our role is to encourage people to protect themselves in the same way we encourage people to exercise, in the same way we encourage people to eat healthily. I see vaccination as a large part of that to keep people safe. And I would encourage anyone who's been invited to be vaccinated, who's in one of those groups, if you have any concerns or questions or queries, just message in or come and see me personally, and I will happily talk to you or discuss with you why you should have the vaccination.
Yeah, very good plug there. And by definition, if you're eligible for the COVID vaccine, then you're probably going to be eligible for the flu vaccine as well. So tell us about the process of getting the COVID vaccine at the moment.
So if you're in one of the eligible cohorts, usually you'll get a message from the NHS. But if you haven't, and there are some who have patients I've met who have not had a message from the NHS, but you think you are, just come into the pharmacy and we can discuss it and we can look it up to see if you're eligible. We will, from your date of birth and your details that you will give to us, we will find your records online and we can vaccinate you from the information that you give. We can advise you to see if you're eligible or not. People are more than welcome to attend. It's those who are eligible and they've not had a vaccine since September. We started this process, this current season, in September. So it's important to know as well. A lot of people have come to me and said to me, "I've had my 2 vaccines. I don't need any more because I've had my 2, and that might have been the first 2 that they came out. I've had my first one, I've had my booster one. Why should I have another one?" So the vaccine has changed about 5 times to change with each variant that's come through. So it's important to note that we need to protect our people, our communities, those who are vulnerable from the current virus that's circulating in society right now. So the current vaccine that we're using is different to the one that came out in at the end of 2001. So I would encourage you all to have a think and come forward if you've not had it yet.
Yeah, so we know that COVID-19 virus is transforming itself, it's changing, and then you get a variant. There's different variants that are circulating. One is currently predominant, but every few weeks to months we're hearing about a different variant and slight difference in the way it behaves and the symptoms that people may present with. And so you're saying that the current vaccine that we need will hopefully give a level of protection to newer strains and variants of the COVID-19 infection.
That's right. So I had some interesting anecdotes. Some people who work at the hospital have been calling me to find out which version of the vaccine we're administering to patients at the moment, because they're frontline health and frontline health care workers. And I explained to them, we go, look at the packet, and it's the XBB 1.5. They say, yes, that's the one I want. And they'll come. And when they come and attend, how do you know so much about vaccines? They say, I'm a virologist at the hospital. And the hospital and some respiratory consultants have been to the pharmacy as well. And they're explaining to me that some of the wards are full of patients with COVID. So they're quite keen to get vaccinated themselves, especially before the holiday season, to protect any parents or elderly relatives they have, to protect them from getting the vaccine as well, as much as they can.
And are you experiencing many people coming back to you after having the vaccine with side effects?
I haven't. But there are always some side effects from vaccinations that you can get. These are usually quite minor and transient. You can get a sore arm, typically, or you can get a mild fever within the day or two afterwards. And I always tell patients, once you've had a vaccination, if you feel a bit sore for the next 2 days or so, just take some paracetamol. And symptoms usually alleviate very quickly after that. There's no reason to stop doing any normal activities that you would normally do after a vaccination, any vaccination.
Yeah, and I mean, that's been my experience as well. As the listeners know, I'm a local GP. We did COVID vaccine program at the surgery, our site, Woodhouse Medical Practice, for Chapeltown residents. And to be honest, I haven't seen anybody really who's had a vaccine and complained of a problem. And as you say, most of the side effects are transient, short-lived, maybe a bit of a sore arm, a bit of redness, a little bit under the weather. Nothing that paracetamol, ibuprofen can't sort out for them.
Absolutely. And that applies the same to all vaccinations.
That's a good point. Yeah, it's not individual to COVID-19 vaccine.
That's right. So we as at our pharmacy, we've been doing vaccinations for a long time, since before COVID began. When people go for a Hajj and Umrah, it's mandatory to have a vaccination before you go, meningitis vaccination. And there's other parts of the world where there are tropical diseases that we don't get in the UK. So we've been doing these types of vaccinations for a long time now. And these types of side effects are typical of what people have always experienced. It's nothing new. So
you're just telling us a little bit more about what a pharmacy might be able to offer. Your pharmacy clearly is a holistic pharmacy, and you are offering not just a COVID-19 vaccine, but sounds to me like you're able to offer a travel clinic as well, where people are able to come to see you if they are traveling to parts of the world, or indeed to pilgrimage to Saudi Arabia, where they can receive their required vaccines. That's a paid service, isn't it?
Absolutely. So the NHS has limited resources. If you are lucky enough to be able to travel to other parts of the world on holiday, some parts of the world we get exposed to diseases that we don't get in the UK, perhaps through different vectors like mosquitoes, things like in parts of Pakistan you get dengue fever. There's a new vaccination that just come out for dengue fever, or there's anti-malarials you can get. And so as part of keeping people safe on their holidays, the people go away to have a nice time, and part of that is to stay safe during their travels, during their holidays. So we look to protect them against getting illnesses whilst they're abroad.
So the COVID vaccine's free?
Yes.
Yeah, just to let people know about that and confirm that, you can turn up to a pharmacy that may be offering the COVID vaccine. Not all of them will, but yours certainly does, which is great. But there are other places where you can go. There may be a local NHS vaccination service where you can walk in. You can't actually book online or by calling 119 anymore, I'm reading. And also, interestingly, it's saying here that the last date that you'll be able to get your seasonal COVID-19 vaccine is the 31st of January 2024. Is that right?
That's right. So officially, the COVID vaccination campaign ended on the 15th of December. That's up until the 15th of December. You could book it through the NHS National Booking Service. With the NHS, the ICB have kept some sites open just to encourage those, allow time for those who haven't been able to get vaccinated up until now, opportunity to get vaccinated now. So we will continue to do it as a walk-in service. We ourselves are providing it on a Monday, Wednesday and Saturday as a walk-in service. I would encourage people to call and let us know that you intend to come beforehand, because the vaccine itself comes in a vial of 6. So we try to avoid wastage as much as possible. So that's important to bear in mind as well. Also, if people have not had their flu vaccination, they can get those done at the same time. You can still check on the NHS website which sites are available. If you don't live near Hare Hills, you can check on the NHS website to see which sites are still doing the COVID vaccination as well.
Thank you so much. Let's just move on to another topic that I wanted to talk to you about. So we know that there's 19,000 appointments that happen in Leeds GP practices at the moment, every day. That's compared to 900 people that are seen in A&E departments in the city. Okay. And people may not be aware that you are also able to offer a help. So there's not just a GP practice or A&E that people need to go to if they need help. Of course, there's NHS 111 also as another service. And in Leeds, we have a couple of the walk-in centres, St George's, and we have Wharfdale as well. But can you tell us a little bit more about what a pharmacist can offer people who may be having what we term as a minor ailment?
Yes, our GPs, we're all one team across the NHS. Our GPs do phenomenal amounts of work, and demand this time of year goes through the roof, and it's hard to keep up with demand for everything at the same time. For minor ailments, as well as if somebody has what we term as a minor ailment, people can get all sorts of ailments. They may develop a cough or cold. They may develop flu-like symptoms, or it could be something as straightforward as head lice. Or at the moment, we're having an issue with an itchy skin condition called scabies, which has particularly affected places like Leeds. You can get help from the pharmacy, and we run schemes in collaboration with the ICB called Pharmacy First, where we can treat those conditions. Often, with if you don't pay for your prescription, we can help you, get the medicine without having to pay for it.
Just on that point, if there's a mum or dad listening right now, their little one needs some Calpol,
Yes.
There are other brands of paracetamol, not just Calpol. But if they need paracetamol and they don't have enough money to pay for it, what's the situation if they walk into a pharmacy?
Okay, so it's different. The different pharmacies are commissioned for different services, but for those pharmacies that are currently commissioned for Pharmacy First, and that's not all pharmacies, we can offer to supply the paracetamol free and claim it back, the cost of it back from the NHS. But that contract, we work in collaboration with the NHS, and part of that service is, as you would with a GP, we'd want to see the child. We'd want you to bring the child with you so that we can do some basic checks to see how ill that child is. We want to take some responsibility for that child to see how ill they actually are. So we have a responsibility to the NHS and to yourselves, to the patient, to make sure that child is treated appropriately. So sometimes there are some restrictions on the Pharmacy First scheme when we ask to see the child and the parent says, but the child's got a temperature. You wouldn't go to a GP without taking the patient with you. You can't take a temperature. You can't really assess a patient properly without seeing the patient or taking a detailed or proper history, as we would call it. So I would encourage you to come to the pharmacy, but please bring the patient with you.
Very, very clear advice, and I think safety first. So thank you for that. Adeel, we are about 1 minute from the sweet commercial break. And can I give you the last word? So a minute there.
Thank you. Thank you for having me on. And I wanted to just encourage in our community, we know that in Hare Hills, 15% of eligible patients, just 15% of eligible patients are getting vaccinated for COVID. If you have some concerns, please come and speak to me. Please protect yourselves. I want everybody to be safe. I've had patients who have passed, young patients, younger than myself, who have passed, unfortunately, through getting COVID. I volunteered to do the COVID service, partly because I wanted to protect our community as much as possible. What I've noticed is I'm getting a lot of people traveling from outside Hare Hills coming for the COVID jab, and I'm grateful. I'm happy to do it. Anybody and everybody who walks through the door to treat everybody. But if I'm getting lots of people from Harrogate or Wetherby, but not the people from Hare Hills, I know that the people, my patients in Hare Hills, my community, they are not effectively protected against these viruses. And I want to encourage everybody to come forward for the vaccination.
Yeah, equitable access to the COVID vaccine. It is available. Adeel, local pharmacist from Roundhay Pharmacy. And thank you for giving up your Saturday to spend some time with us. Some vital information about what pharmacies can offer us. Thank you so much. Keep up the good work. And hopefully we'll speak to you again.
Thank you very much.